Well, the CDC says despite the spike in respiratory infections in children in China, there's no cause for alarm here in the U.S. Now, China has told the World Health Organization that the infections are caused by an overlap of common viruses, including the flu, rhinovirus, which causes the common cold, and RSV. The country insists this is not a new virus, though it is triggering flashbacks to the first days of the COVID-19 pandemic for some. NewsNation's Elizabeth Pran has been following this story and has more. So, Elizabeth, has the CDC been able to verify this is not, in fact, a new virus?
Yeah, that's what we're hearing from the CDC, Kelly. But you know what? There really is just increasing worry and panic across the United States. And this is despite the fact that we are getting affirmations from the CDC and that we did hear from the World Health Organization earlier in the week. But Mandy Cohen, who is the director of the Centers for Disease Control, was on Capitol Hill in front of lawmakers taking down some pretty tough questioning. This is her just yesterday.
We do not believe this is a new or novel pathogen. We believe this is all existing, meaning COVID, flu, RSV, mycoplasma. Chinese officials have shared with us that, again, no novel pathogens, that what they're seeing is this. And we were able to corroborate that information across other sources from our European Union partners and others to make sure that we were getting a complete picture.
But Republican lawmakers are still very much pushing back. You can see this is a letter from Florida Senator Marco Rubio, penned alongside a number of other Republican lawmakers. And he says, in part, we should not wait for the WHO to take action. He went on to say, we must take the necessary steps to protect the health of Americans and our economy. That means we should immediately restrict travel between the United States and the PRC until we know more about the dangers posed by this new illness. Important to note that the World Health Organization did emphasize that these are not new pathogens, and you just heard from the Center for Disease Control, Mandy Cohen there, along the same lines. That being said, families are still very triggered because they are seeing photographs of long lines. They are seeing people with masks. They're seeing headlines out of Massachusetts and Ohio with a number of children getting diagnosed with pneumonia. We did speak with a doctor who told us when you look at China specifically, remember that they were on lockdown quite a bit longer than we were, and that could be really causing the spike in infections that we're seeing in Asia. Here he is.
And I think this is just what happens when you have people that are social distanced for a certain period of time, and then they start to interact. And all those common pathogens come back, and they come back with a vengeance.
And he went on to say, if you look at 2022, last year, we saw that big spike in RSV, especially among kids. We're starting to see that again this year. And keep in mind, we were just opening up at that time. So he drew that analogy, Kelly, and that was one thing to keep in mind. Again, according to officials, no new pathogens. Back to you.
All right, important context, Elizabeth. Thank you.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.